Tiffany says, defund until it's unusable, privatise it, instant nepo job for you and your mates, Neolib 101, utter shills. Yeah, the way we've always described that, Clint, is when the right's sitting in opposition, they constantly tell you that government doesn't work. Government doesn't work. Then they become government and they put in place policies that break government, and then they step back and they go, see, we told you it didn't work, but we've got a solution. It's an oligarch who wants to come in and buy this and run it for us. Same thing.
And it's not just limited to the SOEs. In the State of the Nation, Seymour was talking about the health system, and and the other dream has always been education. Having some kind of voucher system, and so don't think that this is limited in their mind to what we would regard as the companies that the government owns, that they would like to privatize core services if they get the chance.
I watch a TV program or a Netflix program at the moment called New Amsterdam. It's a program about a public hospital in, I think it's New York, public hospital in New York. And obviously they're fictional stories, but I believe a lot of the information they're putting out is based on truth. So there's often a storyline that runs through about a lower socioeconomic status person without enough money. They might be working, but they might be working poor. And they're obviously coming to New Amsterdam because it's the public health hospital in the area. And doing things like, there was something said the other day that vials of insulin used to be $26, now they're $250. And I know that's happened. I don't know if there are the exact numbers, but I know. So there's these patients are taking a quarter or a fifth of a vial rather than the dose that they need to keep them alive. Now, look, I'll say it again before the people come for a crack. Yeah, I get it. It's a fictional story, but I believe, and from my research, it's got some pretty true. There are some truth to the storylines they run through it. That's your privatization of the healthcare. That's what it is.
Yeah, absolutely. I mean, that's what's really happening in the States, because insulin has gone through the roof because that slimy guy who bought the patent, remember? A few years ago,
Shrek or something, or some young guy. Yeah.
The
guy who bought the Wu-Tang Clan album, the only one that they were making.
That's right. Ironically, we're somewhat protected from that by Farm Act, which ironically Nationals always liked because it saves a lot of money to the health system. Because if the health system had to, buy without using that negotiating power, then it would, those medicines would be a lot more expensive. But ultimately, if you do go to a fully privatized system, then you don't have a Farm Act, and private systems work by excluding those who can't pay, so that overall they can charge more for doing less.
This is the dude, Martin Shkreli, who bought the Wu-Tang Clan album, and then the Wu-Tang Clan album, I think, got taken off him in bankruptcy, and Tasmanian Museum was going to play it for a while. So there you go. That's the dude, and that's how it works. Because you privatise it, he owns it, he charges whatever he wants for it. Kiwi Bird says of privatisation providing minimal service for maximum profit.